Hello everyone, this video will show you the 4 special tests to assess for low back pain, specifically nerve root impingement. Here are the 4 tests along with sensitivity and specificity from research article. The links are found under the description. The first test is the straight leg raise test, also known as Laseque test, is used in the clinical examination of patients presenting with low back pain. This test used to determine nerve root tension. Nerve root irritation can be due to many causes, most common being intervertebral disc prolapse. The patient is positioned in supine and the examiner gently raises the patient's leg by flexing the hip with the knee in extension between 30 to 70 degrees. The test is considered positive when the patient neurological pain which is reproduced in the leg and lower back between 30 to 70 degrees of hip flexion. It is suggestive of lumbar disc herniation at the L4S1 nerve roots. However, pain that is greater than 70 degrees of hip flexion might indicate tightness of the hamstrings, gluteus maximus, hip capsule, or other pathology of the hip including sacroiliac pain. Sensitivity is 0.52 and specificity is 0.89. The second test is crossed straight leg raise test. This test is done after performing the first test. The patient is in the same position as the first test. The examiner will passively flex the patient's uninvolved hip while maintaining the knee in full extension. A positive test is considered when the patient reports reproduction of pain in the involved limb at 40 degrees of hip flexion or less in the uninvolved limb. The examiner should make note of the degree of hip flexion where the patient reported pain or reproduction of symptoms. This test has high specificity of 0.88 and sensitivity of 0.29. The third test is called the Slump Test. This test is a neural tension test used to detect altered neurodynamics or neural tissue sensitivity, as well as disc herniation. The patient is seated upright with hands held together behind his or her back. The examiner instructs to the patient to flex his or her spine, slump, followed by neck flexion. The examiner then places his or her hand on top of head and has the patient perform knee extension and dorsiflexion of foot. Positive sign is any kind of sciatic pain, radiating, sharp, shooting pain, or reproduction of other neurological symptoms. This indicates impingement of the sciatic nerve, dural lining, spinal cord, or nerve roots. This test has high sensitivity of 0.84 and specificity of 0.83. The fourth test is prone knee bend test. This test is to determine the neural tension used to stress the femoral nerve and the mid-lumbar, L2-L4, nerve roots. The femoral nerve tension test is used to screen for sensitivity to stretch soft tissue at the dorsal aspect of the leg, possibly related to root impingements. The examiner passively flexes the patient's knee to end range and maintains it there for 45 seconds. The hip should not be rotated. If there is pain in the anterior thigh, may indicate a tight, strained quadriceps muscle or neural tension of the femoral nerve. Pain on the unilateral lumbar area, buttock, or posterior thigh may indicate lumbar radiculopathy of L2-L3 nerve roots. This has a specificity of 1.0 and sensitivity of 0.50. Thank you for watching. Please comment and subscribe for more content like this.